Thanks everybody for joining us today. We appreciate you taking the time to be with us for this update. We just wanted to bring you a snapshot of what's been going on in our healthcare system and take a look via Dr. Goldstein at what we might be able to expect moving forward in terms of the pandemic. So joining us today, we have Dr. Kenzie Graves, Associate Chief Medical Officer of Inpatient Care at University of Utah Health. We have Aaron Klaus, who's the Director of Strategy and Alignment for the University of Utah Medical Group, and Dr. Stephen Goldstein, who is a postdoctoral researcher at the U of U School of Medicine. So we're going to start with you, Aaron, to give us a look at some of the models and what we've been seeing and what we might expect moving forward.
Thanks, Kathy. All right, let's get those slides up. Okay, good morning. We have more positive news to show today from where we were a few weeks ago. So this first chart, we're looking at the positivity rate, and that's the number of tests that are coming back positive out of 100. There's two different methods. There's a people over people method and a testing over testing method. And you can see both of those have decreased significantly since the end of January. So looking at 48% decrease in the people over people method and a 52% decrease in the testing over testing method, definitely heading in the direction of recovery there. If you go ahead to the next slide, what I want to make sure that's clear is that although these rates are very quickly decreasing, we're still at really high rates across our state. So the tests that are being done, a lot of them are still coming back positive, and those rates are comparable to what we saw back in 2020 and actually exceed the Delta variant that we saw the last part of last year. You can go ahead to the next one. Similarly, hospitalizations. So when we see positivity rate and cases go down, we see the hospitalizations also go down. So 46% decrease in overall hospitalizations in the state of Utah since the end of January. Go ahead. You can see as you trend that line over, we still have a number of Utahns in the hospital exceeding 500 right now. And it's just as high as the previous two peaks. Definitely heading in the right direction. Continue on. So when we look at vaccinations, those that are unvaccinated are the blue bars, and those that are vaccinated, orange bars. By age group, we can see those that have unfortunately passed away from COVID. Those that are unvaccinated are much more likely to pass away than those that are vaccinated. So this is just reiterating the fact that vaccinations are very important. It's our best tool and our best protection against COVID right now, and to urge you again to get vaccinated if you are not. The last slide. So here we are by age group. What I find really positive about this slide is the majority of people in almost all of the age groups are fully vaccinated or fully vaccinated and boosted. So the green is fully vaccinated, but still yet unboosted. The blue are the people that have received both vaccination and a booster dose. You can see the yellow is a single dose, so not fully vaccinated yet, and red are individuals that have chosen not to be vaccinated. So if vaccinations truly are our best tool, and the booster dose is really the most, it's a very important dose to make sure that we're fully protected. So if you're in one of those age groups, you have not yet received a booster dose, you can see we can really up the numbers of that blue bar and get more protection in our community. Thanks.
Thanks, Aaron. Dr. Graves, do you want to go next?
Good morning. Thanks for having me. I wanted to talk a little bit about the impact of our COVID-19 pandemic in the hospital right now. So the way I describe this is that there are two ways to think about the impact of COVID-19. The first way is the direct impact. So people being admitted to us that are here with a COVID-19 infection. We've seen a lot of that over the last 2 years. And while things are decreasing, we still do have COVID-19 in our hospitals. The second way I think about that is indirect effects of COVID-19. So we have seen a lot of that. So those are patients who have worsening mental health, who have worsening physical health, who have delayed care, who have had a surgery postponed. That's also the impact on our staff. from some of the trauma that we've seen. And so I would say right now, while we still have direct impact of COVID-19, including long COVID, we have a lot of the indirect effects as well. We appreciate and admire our staff that continue to show up day after day after day, providing excellent care to our patients. But yes, things are stressful here in the hospital. This morning, we only have a few open acute care beds and many people that need those beds. Our ERs are busy, as are our acute care units. And so I would say that while COVID might be waning in our community, we still do see effects here in the hospital. We appreciate our community doing the best they can to help take care of us, and we will continue to serve the Salt Lake community as much as we can as well, and the Utah community.
Thanks, Dr. Graves. Dr. Goldstein.
Yeah, so just first echo what Erin said, that clearly the numbers of new cases and associated impacts of that are declining from the Omicron wave that began in December and January of this year. We are seeing a slight increase in the frequency of the Omicron subvariant BA.2 that a lot of people have probably heard about. But at this point, we're not experiencing a new wave of infections as a result of this subvariant. We'll see if that continues to be the case. And of course, there's still the potential and likelihood for new variants to emerge in the future that we'll just have to continue to track and assess their impact on vaccinations and our healthcare system as we go.
Thanks, Dr. Goldstein. And Dr. Goldstein, I think this first question, and so members of the media, just please, use the chat to ask your questions. But the first question, Dr. Goldstein, I'm going to give to you: are COVID rates really going down, or do we not really know because more people might be home testing? Can you speak to that?
I think it's likely that COVID rates are in fact going down. That's reflected, I think, in the hospital data that Erin showed and Dr. Graves' comments, because whether people are being tested at home or at testing sites, if they become very sick, they are going to appear in the hospitals. So hospitalization rates are a lagging indicator because people don't get hospitalized on the day that they test positive, of course. But if the cases weren't actually declining, we would see a flat curve on those downstream impacts of new infections. So I don't think there's any question that new infections are declining right now, and hopefully that'll continue to be the case.
Thanks, Dr. Goldstein. Is there another variant of concern emerging in Europe or elsewhere right now? I think maybe you might also know the answer to that.
Sure. So right now in most places, the BA.1, the original version of Omicron that we became aware of, continues to dominate globally. In certain parts of the globe, the sublineage of Omicron, BA.2, is increasing in frequency. In some cases, it's overtaken BA.1. But this is still considered part of the Omicron lineage. And as far as I know right now, there haven't been any new variants that have emerged that appear to be doing anything concerning at this point. I'm imagine that at some point such variants will emerge, but we'll just have to wait and see and keep track of and prepare for their impacts as that happens.
Okay, and Dr. Graves, I'm going to give this question to you. I don't know that we're in the best position to answer this, but we can give it a shot. Is the state on track to shift to treating COVID as endemic by the end of March? What would that look like compared to a pandemic? I don't know if that might be best left for someone from the state to answer, but do you want to maybe address that to the extent that you can?
Yeah, no, I agree. I think to answer the state response question really should be with the state, but I will talk a little bit about what we're thinking about here at the university. So we are just coming up on 2 years of doing this, and that I think has been very fatiguing for a lot of people, including those of us in healthcare. I think most of us recognize now that COVID-19 is not going to go away, that we are going to have to find a way to live with it and mitigate risk from COVID-19. The most important thing, as Erin pointed out, is vaccination and getting a booster. So we know from an article that came out last week in the New York Times, the United States had higher mortality from Omicron than other similar countries. So boosters do matter, and I would encourage everyone that has not gotten one to get one, as I think that as we move forward and more states roll back some of our health protections that we've been doing, like masking, like social distancing, the risk of infection is potentially high and higher than it's been. And so vaccination matters, booster matters. What we were thinking about here at the university is how, sorry, I forgot to take this off. How can we best start to recover and be able to move toward what might look like a new normal? I can't comment on pandemic versus endemic, but for us, we're thinking about how do we take care of our staff? How do we appreciate our staff? How do we maintain resilience within our healthcare community? Does that answer at least what I can about that question?
Yeah, I think so. Lisa, any follow-up to that or?
Yes, if I could, and it's just easier than typing. I'm interested from a medical professional perspective on that shift to treating it like an endemic. If you feel as medical professionals dealing with this disease that we are on track to treating it that way as opposed to a pandemic, and for the general public, what that would look like. And what it looks like from your perspective, again, as medical professionals. Thank you.
Yeah, there's a lot in that question. Some of this is my personal experience as a physician. So I want to say that a lot of what we did in the COVID-19 pandemic to this point has been absolutely appropriate. So what we had to do was protect our hospitals, protect our ability to take care of as many people as we could, keep each other safe. We didn't have access to a lot of the treatments and prevention tools that we have now. We didn't have that in March of 2020. So we are currently living in a different world. So now we have medications we can give, we have vaccinations, we have boosters. So things are different now. I think it's also important to recognize that there have been, as I said before, indirect effects of our management of the COVID-19 pandemic. So we have people that are socially isolated. We have people that are sicker. And I think we have to evolve how we take care of people to be able to address all of those things. I think one thing I'm grateful about in potentially evolving how we've responded to the pandemic is we're talking about things like mental health now, and we weren't necessarily doing that in 2020. So my personal perspective is I think that we are going to need to be a little bit flexible as we move forward. And so as a physician, when I'm on service, I'll probably have some COVID-19, I'll probably have some other illnesses, and that's really what life looks like for me now. What we do socially, I think, is also maximal flexibility, right? So I think we know that COVID-19 is a risk. How do we mitigate that risk and when? It really depends on our risk level, people we're seeing, if we have immunocompromised people that live with us, things like that. And so I think it's an individual choice, and we have tools at our disposal that we can be thoughtful about how to use.
And following up on that, Dr. Goldstein, a question for you. Will masks and social distancing be part of our new normal?
So I think to the extent that SARS-CoV-2 and COVID-19 continue to be prevalent in our communities, these will continue to be important tools that we can use on an individual basis to mitigate our risks. I also think we can think about this, hopefully, as we transition to perhaps a more predictable stage of the circulation of this virus, that if, during particular waves, it might make sense to continue to make the choice to use high quality masks to protect yourself. And there will be other times when cases are quite low where you can not have to worry too much about that. And I think the same would apply for things like spending time in, going out to eat in restaurants, concerts, shows, things like that. But it really is going to come down, I think, from this point forward to personal risk calculations. I think personally those tools will still have an important role to play at times when circulation of the virus is high. But I also think that hopefully that will be a less constant concern than it's been to this point.
Okay, a question here. The governor said testing will shift to healthcare. Is the university equipped to take that on? I'm going to jump in here real quick and let you know we are increasing our capacity at University of Utah Health for individual testing via kiosks. And so we have some information about that coming out today. We have some new locations that we're adding, and we have an increased capacity to do that kiosk testing. And Dr. Graves, do you want to follow up on that?
The question about testing in healthcare, or I guess okay.
Yeah, are we prepared as a healthcare system to take on, now that the state is kind of ratcheting down their testing, and the governor has said that testing will shift to healthcare systems. Are we prepared to take that on?
Got it. Okay, so let me talk about, I think, two things. So first, I'm just going to add a little bit to what Dr. Goldstein said, and said we have a couple of other tools we can use to monitor the prevalence of COVID-19 in our communities, even if people are doing a lot of home testing, which I think is a really important tool. If we test at home, we know we can isolate, keep other people safe. We can monitor wastewater. So if we look at that, we can see that COVID-19 and SARS-CoV-2 are decreasing as a state. As far as the U's ability to respond in testing, while not a test expert here at the U, I think what I have seen working here and what I have seen as a member of our community, I've been very impressed the entire time about the university's ability to respond flexibly with testing. And again, I'll defer to the announcement later this week about details.
Yeah, Erin, we'll get you some specific details and get everyone those details. We were actually going to be putting some of that out today on social media, but I'll send specifics to this group about our testing capability right now at some of our community clinics. Okay, a question here. We've heard treatments for COVID were extremely limited earlier. Is that no longer the case? And can you talk about what's available both in terms of prevention and treatment? Dr. Graves.
So I can talk a little bit about some. So what we have known is that some of the antibodies have not worked as well for Omicron as they have for prior variants. So some of those have been less available for that reason. We did have limited resources of Paxlovid earlier in 2022. The criteria for obtaining Paxlovid have gotten broader over the last few weeks. So there should be more access to that. I think some of these, the best thing to always do is to talk to your physician, to think about drug interactions, things like that. But yes, I think many of them are more available than they were several weeks ago.
And then in terms of prevention, what do you think?
I think it depends on an individual's risk. So we've talked a lot about vaccination. We've talked about boosters. So I think that it's important to remember, as many people got sick with the Omicron variant, having a booster did still matter. So we had the booster reduced our likelihood of getting infected with Omicron by about 57%, looking at some studies, and then also reduced deaths, hospitalizations, and those things are very, very important. So vaccinations being boosted. There is some data coming out on a fourth dose for people that are severely immunocompromised. And so I think those are individual discussions with one's doctor as well. And I think for someone that has a high-risk family member, is high risk, is immunocompromised themselves, that person may want to continue to take precautions such as masking, things like that. The other one I want to talk just a tiny bit about is Evusheld. It's probably not as well used as that could be. And so that's something else to talk with physicians about, whether that would be the right medication for someone with a COVID test is positive.
And then quickly, how important do you think it is for people to still mask when they're in public for at least the next few weeks?
It's a really good question. And so I want to go back to a couple of things. So first, I have said this previously, and I'm paraphrasing from someone else, but as we come down of a surge curve, that's still half the cases. So there are still a lot of COVID cases in our community, as Erin pointed out. While things are coming down, and that's a wonderful sign, there is still as much COVID in our community as there was during our fall, winter 2020-2021 surge. So it's still out there, it's still a risk. For me, I think it depends on what an individual's risk factors are and what the likelihood of contracting COVID-19 in a specific area would be. So for example, I personally would be masking in a crowded indoor space. I will be masking for the next several weeks, but I don't know that that's necessarily needed in a well-ventilated area with one other person outside. And so I think it's an individual decision, but to think about what's the risk of me getting COVID or any viral infection in my community right now? How well protected am I in this building? Do I have my booster? Do I have my vaccination? All of those things should come into account.
Thanks, Dr. Graves. Dr. Goldstein, is there any way we can get ahead of the new emerging variants? Is vaccination really the only way, or is there anything we can do from a public health perspective to get ahead of these variants?
So I really do think that vaccination is the key here. What we've seen with Omicron was that 2 vaccine doses lost a significant amount of their efficacy against this new variant because of how many mutations this virus has in its spike protein. But 3 doses really restored that, and the improvement in protection from 3 doses against Omicron appears to be fairly durable at this point. So I think the best defense we have is to continue to vaccinate, and people should get their 3rd dose if they haven't yet. And we'll see if there's a need for further doses down the road, like the way we see with the flu vaccine. I think it's just too soon to say at this point. But the best way to stay ahead of new variants is to just vaccinate as large a percentage of the population as possible. And that's going to give us the maximum amount of protection, make future waves of infection less impactful in terms of hospitalizations and deaths. And that's a really critical factor to think about as well.
And I think the magic question that everybody wants to know, I mean, what do you think from a public health perspective? What are you hearing? Is there just no way of knowing, or are we certain there's going to be another variant of concern? Can you tell us? Can you look into the future for us?
Yeah, so viruses are always evolving, and we know that with seasonal coronaviruses, so the 4 coronaviruses that cause a significant fraction of common cold type infections, those do evolve over time to the point that protection from being infected a couple of years ago is no longer very effective at preventing you from getting infected a couple of years down the road. But we don't have vaccines for those viruses. And so protection that we're able to provide the population from SARS-CoV-2 is actually significantly more robust than the protection that we get from being infected with other coronaviruses. These vaccines we have for SARS-CoV-2 are among the best vaccines we have for any respiratory infection. They're even more effective than influenza vaccines, which themselves do a really good job at reducing the hospitalization impact from that virus. And so, predicting what new variants are going to emerge, I think, is extremely difficult. We can say that there will be new variants that emerge over the course of the next several years and beyond. But, exactly what the nature of those variants will be less important to know the larger a fraction of the population we can get vaccinated. Because regardless of what those variants look like, if we have a very large fraction of the population vaccinated, the impact of those variants is going to be limited.
Okay, thanks. What is the lag time for COVID surges before it appears in hospitalization data? Early in the pandemic, it was talked about as 5 days to a week. But is that lag time understood to be shorter now? And does that change with different variants? I don't know, Erin, if this is something you could answer, or
I don't know if there's been any change in the lag time there, but it was about 7 to 10 days that we saw cases, and then a peak in hospitalizations. And that's held true through the first 2 peaks. And I don't know about the new Omicron wave.
I can comment briefly too, Kathy, if that's helpful. I feel like we've seen a number of days similarly. So for Omicron, in watching how things have increased and decreased, it's been on average, I think, between 5 and 10 days. There are patients who come in very, very sick and their diagnosis of COVID-19 is made on the day of admission, but that is almost never the day that they're symptomatic. So it's usually several days in, similar to what it has been before.
okay, thanks. Question here, there are reports that the CDC is not making public all of the data collected on COVID-19. Does that cause concern? And if so, why? Dr. Goldstein, do you want to take a stab at that one?
Yeah, so it's a little bit hard to comment on the specifics of that without knowing exactly what data the CDC has and why it may not be released. There may be good reasons, like concerns about the quality of the data, to not release it. In other ways, there may just be, I think we've all observed some degree of a lack of coordination at the national level in response to this, and compared to some other countries like Denmark or the United Kingdom. And those are questions that we should ask and hope to address in advance of the next pandemic, which will come. I can't tell you when, but we would benefit from, without getting into the specifics and without knowing a great deal about the specifics, I do think we would benefit from a better national coordination system for events like this.
And Dr. Goldstein, with this talk of a 4th vaccine, we know currently people who are immunocompromised should get a 4th vaccine. when it comes to the general public, there was some news released yesterday that possibly a vaccine could be folded into the flu vaccine next fall and that sort of thing. Will that vaccine be the same one, or will it be updated to better fight Omicron variant? Do you know anything about that you can tell us?
I don't know anything about that. There is a concern with updating the vaccines because this virus does seem to move so quickly, frankly, when new variants emerge, that you could suffer a little bit from fighting the last war. So far, it looks like, for example, the original vaccine formulation that we have with 3 doses for a healthy, non-immunocompromised person provides fairly broad protection. So the 3rd dose gives good protection against Omicron. Also, as we know, that original vaccine formulation provides very good protection against prior variants. In contrast, it appears that being infected with Omicron alone, if you weren't infected in previous waves and now you've been infected by Omicron in the recent wave, you actually don't get very broad protection against other variants from just exposure to the Omicron spike protein. So there may be a risk, for example, in updating the vaccines to include the Omicron spike, that we may not get that broad level of protection against the next variant that emerges. So I think at this point, the best scientific data would suggest that we keep the vaccine formulation as it is. But I do think that the vaccine manufacturers, in coordination with the FDA and other regulatory agencies, will continue to look at that. And I do have confidence that we'll be able to make the best decision in that regard.
Okay, do we have any other questions from media this morning? If not, I'm just going to go through the group for any final thoughts. Erin, I'll start with you. You're on mute. You're on mute.
Thanks, Kathy. I would just reiterate again that the booster dose and the importance of that in preparation. If another variant comes along and we have more of the population boosted and fully vaccinated, the entire community does better. So if you have not yet received your vaccinations or a booster dose, please reach out to your healthcare provider and ask the questions and hopefully receive the booster and the vaccine.
Okay, next I'll go to Dr. Goldstein, and then we'll end with Dr. Graves. Yeah,
so I would certainly reiterate what Erin said, that vaccination is the best way to prevent a significant impact from future waves of infection of this virus. When we're thinking about this idea of the virus becoming endemic, to the extent that that means that we can live with this virus without having the massive impacts that we've had so far, really depends on vaccination. So, for example, influenza is an endemic virus in that it's always circulating at some level amongst the human population, but we do see seasonal waves or epidemics of influenza, and they can kill thousands to tens of thousands of people a year. With low vaccination rates, even endemic SARS-CoV-2 could cause a significantly larger number of deaths than that. It's been estimated as much as 100,000 people a year, for example, but we can bring that down very significantly by vaccinating as large a fraction of the population as possible. So, as we make this transition into a more endemic phase, we need to keep in mind that how severe the endemic circulation of SARS-CoV-2 really does depend on us and individual choices of people to go get vaccinated, get boosted, and things like that.
Dr. Graves?
So I think those were beautifully stated, and I don't have a lot to add. Again, I'll echo that I think vaccination is critical, especially as we move forward with recovery, and there may not be as many public health measures as there have been in the past. Getting boosted matters. It reduces the likelihood of hospitalization and mortality. I think, again, the more of us that are fully vaccinated and boosted, the better the community does as a whole. I think it's important to keep in mind that all service industries struggled with staffing over the last several months. And so I, again, would urge people to be kind, try to take care of those that are trying to take care of you. And then, again, the U is here to serve and take care of as many people as we can. Thank you for having us today.